Assalamualaikum. Today, my friend and I from Group 5, Class BA2354C will be presenting on Chapter 7, Disease of the Eyes and Nexa, specifically to glaucoma and blindness. Let me introduce to you myself first. I am Puchi Fatinurain binti Nur Fazilan. Let's go through to the prevalence of glaucoma first. Glaucoma is the world's second greatest cause of blindness, according to the WHO. The rising prevalence of glaucoma has become a concern in Malaysia, especially since Asian population account for 50% of glaucoma cases globally. According to the Tan Sri Dr. Nur Hisham Abdullah, the Health Director General, the prevalence of blindness in Malaysia is 1.2% of the population, and among the main causes are cataract 58.6%, diabetic retinopathy 10.4%, and glaucoma 6.6%. What is glaucoma? Glaucoma is a group of eye diseases that damage the optic nerves located at the back of the eye caused by the high pressure in the eyeballs, which lead to a gradual visual loss and blindness. It often occurs due to fluid built up in front of the eye, increasing pressure inside the eye, but it also can occur even with a normal eye pressure. The optic nerve is vital for eyes as it is connected with the brain to transmit visual information. There are two common types of glaucoma, which is open-angle glaucoma, which is caused by the blockage in the eye's drainage canal as a result of fluid built up known as aqueous humor, and the other one is close-angle glaucoma that occurs when the angle between iris and cornea is too narrow. A person with glaucoma will experience eye pain, headache, red eyes, blurry vision, nausea or vomiting, and rainbow-colored halos around lights. Besides, code block for glaucoma is H40 until H42. Majority of glaucoma cases involve a person who is aged 50 and above, involve a trauma, having a family history, poor medical conditions, and steroid usage. The treatments for glaucoma include laser, surgery, medications, and prescribed eye drops.
My name is Tengku Shafika binti Tengku Effendi, and I will explain the first and second guideline of glaucoma in ICD-10-CM. The first guideline refers to the specific category of H40 within the ICD-10-CM coding system. There are several varieties of glaucoma. The codes in category H40 enable to diagnosis of a patient's particular form of glaucoma. It is possible to identify which eye is impacted by the glaucoma. Different phases of glaucoma can develop, and these stages are likewise designated under category H40. Second guideline refers to a patient who has glaucoma in both eyes, and both eyes are documented as having the same type of glaucoma and the same stage. For example, primary open-angle glaucoma with the same severity of the condition. Use the code designated for bilateral glaucoma if there is one available in the coding scheme. However, you simply need to provide the glaucoma type code and the 7 character denoting the stage. This is also as the official diagnosis of bilateral glaucoma already takes place into account the fact that the condition affects both eyes and is of the same type and stage. Bilateral glaucoma may not have a distinct code in certain classification systems such as subclasses H40.10 and H40.20. If there is a particular code for bilateral glaucoma, report the patient's glaucoma type using only one code to indicate the glaucoma stage at the 7 character. So that's all from me. Thank you.
Hello everyone, my name is Sharifa Alamaisara, and I will further discuss on step 3, bilateral glaucoma stage with different type or stages. There are 3 different situations in this section, with all of our patient has bilateral glaucoma. First one, different type or stage and laterality is mentioned. Assign the appropriate code for each eye rather than the code for the bilateral glaucoma. For example, H40.11 primary open angle glaucoma and the other eye is H40.23 intermittent angle closure glaucoma. Next, different type for each eye and laterality not mentioned. Assign code for each type of glaucoma with the appropriate 7 character for the stage. For example, H40.10 unspecified open angle glaucoma and the other eye is H40.20 unspecified angle closure glaucoma. Lastly, each eye having the same type but different stage and laterality not mentioned. Assign the code for the type of glaucoma for each type with the 7 character for the specific glaucoma stage documented for each eye. For example, H40.1111 primary open angle glaucoma, right eye and mild stage. And the other eye is H40.1122 primary open angle, left eye and moderate stage.
My name is Elizabeth Salihuddin. I will continue to the next guideline. First, patient admitted with glaucoma and stage evolves during the admission. If a patient is admitted with glaucoma and the stage progresses during the admission, assign the code for higher stage documented. For example, if the patient admits with mild stage chronic angle closure glaucoma, right eye, and during admission, the stage is progressed to moderate stage H40.2212, chronic angle closure glaucoma, right eye, moderate stage. Second is indeterminate stage glaucoma. The 7 character for indeterminate stage should be based on the clinical documentation. The 7 character 4 is used for glaucoma whose stage cannot be clinically determined. This 7 character should not be confused with the 7 character 0 unspecified, which should be assigned when there is no documentation regarding the stage of the glaucoma.
The next eye condition is blindness. So, according to the results of the Health Ministry's National Eye Survey, up to 160,000 Malaysians aged 50 and above suffer from impaired vision, with 8% of them having blindness. So blindness is defined as a condition with a lack of vision or inability to see, either partially or completely. There are a lot of leading causes including infections, injuries, and medical conditions such as cataracts, glaucoma, and even cancer. The symptoms of blindness include cloudy vision, eye pain, sensitive to light, eye flutters with flashes, the incapability of seeing shapes, and lastly, impaired night vision. The treatments include cataract surgery, medication, corneal transplant, retinal surgery, and vitamin supplements. For the guidelines, if blindness or low vision of the eye affected is documented, but the visual impairment category is not documented, assign these codes according to the affected side, either both eyes, one eye, or even for the unspecified, if no information whether one or both eyes are affected. Thus, assign code H54.3 for both eyes, code H54.6 for one eye, and H54.7 for unspecified affected eye.
Hello and hi, I am Nurliza binti Abdullah and I will share how to solve 2 case study on this topic related to glaucoma and blindness. First, office note. This 4 years old male patient was brought to my office today by his mother. She stated that he is consistently confusing the colors red and green. I had the child view various Ishihara color test platelets, and testing revealed color blindness. Okay, now let me explain briefly about the Ishihara color test. Ishihara color test is a method to determine color blindness, particularly red-green color deficiencies, in which the subject is asked to distinguish number of dots that are different color that the dots surrounding them. Now let's go through on how to find the coding for this case. For the case shown, the diagnosis is color blindness. So the first thing you need to find is blindness through the index table, because the main term here is blindness. Under the blindness category, find the words color, and you can see the explanation further after the words color, which is C deficiency, color vision. After that, search that the color vision under the main bold words deficiency. The code present there is H53.50, and you can check it using tabular to reconfirm the correctness of the diagnosis. To conclude here, code H53.50 unspecific color vision deficiency represent the diagnosis of the color blindness. Second question, observation notes. This patient is being placed in observation due to an increase in the symptom of her acute angle closure glaucoma in her right eye. At several stages, she is being placed on IV meds to see if symptoms decrease. She will be monitored, and then admission for peripheral iridotomy will be made if indeed. So, acute angle closure glaucoma is a serious eye condition that occurs when the fluid pressure inside the iris quickly by peripheral iridotomy is a procedure in which a small section of peripheral iris is incised through a limbal incision. So firstly, in the case, find the words glaucoma. Next, find the acute under the branch of angle closure. Check the code H4.21 in tabular, and you will see multiple acute angle closure glaucoma, but in this case it states her right eye is affected. So the last answer for the case is H4.211, acute angle closure glaucoma right eye. So that's all from our group on this chapter. Thank you.